is the pre-op charges generally done in the office setting. So this is what I found on that subject. So it was kind of a general question, so I kind of had to guess at what they were really asking. So I'm going to assume that they're talking about either the history and physical that's done prior to the surgery, or sometimes it's that clearance, that pre-op clearance visit that might be being done by a cardiologist if the patient has heart problems, that sort of thing. So pre-op services can include the history and physical, usually done a day or two beforehand, because they're trying to make sure everything's okay with the patient. They don't have the flu all of a sudden. They're about to go into surgery. That would be a no-no. But that H&P, per the guidelines, is bundled into the surgery code. So the surgeon cannot bill for the H&P. It's part and parcel of the CPT code that they're going to report. And here's where it says it in the guidelines, in the surgery guidelines. It says the services provided by the physician to any patient by their very nature are variable. The CPT codes that represent a readily identifiable surgical procedure thereby include, on a procedure basis, a variety of services. In defining the specific services included in a given CPT surgical code, the following services are always included in addition to the operation per se. So when you see the CPT code and the definition to the right of it, there's a lot more that's included. In the guidelines, it tells you all of this is also included. Local infiltration, meaning getting the area prepped. It could be doing that initial topical numbing sort of thing. And this is the key, this bullet here that we're talking about. Subsequent to the decision for surgery, one related evaluation and management encounter on the day immediately prior to or on the day of the date of the procedure. And it says including history and physical. So that pre-op visit is included. Okay. Now that subsequent to decision for surgery, what that's about is, and it could be months before, it could be a week before, it depends on how urgent the situation is. You're probably going to be talking with the physician and say, you know what, we really need to take care of this surgically. Let's get you scheduled. That E&M visit is billable. It's not the pre-op visit. So that's when you use that modifier 57. That says decision for surgery. Now you probably don't need it if it was weeks before the surgery, but if it's on the day of or the day before, then they're not going to pay it. They're going to say, oh, this is that pre-op visit, it's bundled in. The 57 tells them, no, this is the E&M visit where we decided to do the surgery, okay? So the next type of scenario, if your office is doing pre-op clearance, maybe for lung or cardiac concerns, and there's medical necessity, that's key, and they're not the surgeon doing the procedure, the surgery, then that visit can be billed as long as it's medically necessary. So that's what my research revealed. A lot of times they're wanting to bill for this visit when it's actually bundled in. So hopefully that answered that.